For our population who access our services, it shouldn't make a difference whether or not they're coming onto the North Tees, South Tees or at our Friarage sites. They should be able to expect the same level of service no matter where they access it from, and we've got a consistency across our group model.
Choosing where you want to give birth is probably one of the first decisions that you will make in your pregnancy. We appreciate that it can be a really difficult decision to make, particularly if you don't know what your options are, so your community midwife is there to provide you with information for options. The first is our obstetric-led unit at Stockton, so that's the University Hospital of North Tees, and then we also have the option for home birth. So depending on whether your care is high risk or low risk, that might help you to choose what you want to do, but ultimately wherever you choose to decide to have your baby, we'll take care of you, our team will look after you and we'll make sure that you and your baby are safe.
So if you think that you're in labour, you would call the maternity advice line. We would invite you in for assessment. You would come to us using the main entrance where the revolving doors are situated, make an immediate right, follow the signs for ward 18 to 19. You would press the buzzer and we would come and let you in. Our delivery rooms are lovely. They're all en suites with either baths or showers. We have mood lighting, twinkling lights in the ceiling, aromatherapy diffusers. You can bring your favourite playlist, your own little speaker, and we will try and make it as comfortable as possible for you. We just want to make sure that you've got a nice, relaxing, calming environment to have your baby. You're allowed one birthing partner to stay throughout your duration here at North Tees in the antenatal, intrapartum and postnatal period. So you can have someone there with you at all times to look after you and help look after your baby, as well as the care that we'll give you. At North Tees we have an on-site canteen, an on-site coffee shop, and over the road we have a bakery. We will provide you with food throughout your stay with us, and following delivery we'll give you the best tea and toast you've ever had.
Pain relief in labour and need for pain relief in labour is quite subjective. It depends on how you are. The most commonest that is used is what we call the Internox, which is called the gas and air. If that's not enough, there are oral pain relief options like paracetamol and codeine. If you need something more, then you can have the injections, which is the diamorphine. And in the end, you do have epidural, which is administered to you by an anaesthetist and monitored by our midwives. And in the end, pain relief is entirely your choice. You have a say regarding what you want. About 20% of women will need an emergency C-section, and that hasn't changed much over years. But now you're having a choice where many women are opting more for C-sections. So if you need to go to theatre as an emergency, the theatre is within the same block as your labour room. It just takes us 5 minutes to wheel you down. Yes, it can be quite a terrifying situation if it's an emergency, but there are various categories of emergency. Most of the time you'll have time to discuss your need for a cesarean section, and we'll try to make it as communicative and seamless for you. At every point you will get a chance to discuss your need for C-sections and the steps that is coming with it during the whole process. Our special care baby unit is manned by consultant pediatricians and neonatologists. We have specialist pediatric and neonatal nurses. At the moment, we care for babies who are 30 weeks and older. Anyone younger than that, we try to transfer them out to our sister unit, which is James Cook University Hospital. Giving birth, being a mother, is a wonderful feeling, but the fact that you have such a good team working for you should give you a lot of reassurance, and we would love you to choose our hospital to give birth.